ladies will present with menstrual problems which can range from no periods, irregular periods, bleeding less during the period. Patient may present with features of hyperinsulinemia and hyperandrogenism, that is excess male hormones. The features are oily skin and acne, obesity. If a mother is a PCOS patient, the likelihood of a daughter getting it is around 80 to 90%. Through the reproductive age group and even after the menopause. Because of the excess estrogen, it can cause endometrial hyperplasia and endometrial cancer in the menopausal stage. Hello everyone, I am Dr. Rugmini, Senior Obstetrician Gynecologist, Bewell Hospital, Poonamalle. Today I am going to talk to you about a very common gynecological disorder we see in our day-to-day gynec practice, that is polycystic ovarian disease. First we will see what is polycystic ovarian disease. It is the most common endocrine disorder which disrupts the ovarian function, forming cysts in the ovary, and the ladies will present with menstrual problems which can range from no periods, irregular periods, bleeding less during the period, or there may be heavy bleeding during the period. Another important problem with the PCOS is infertility. PCOS patient can present with infertility also. The other problems the PCOS ladies present with is acne, hirsutism, abnormal hair loss. Patient may present with features of hyperinsulinemia and hyperandrogenism, that is excess male hormones. The features are oily skin and acne, obesity, and thickened and pigmented skin around the neck, which is called acanthosis nigricans, and there can be either excess hair on the face or male type of baldness. Now we will discuss about the causes of PCOS. Exact cause of PCOS is not known, but it is hypothesized that it is caused by many environmental factors and genetic factors. Coming to the environmental factors which can cause PCOS is like lifestyle changes, increased weight gain, obesity, faulty food intake, and environmental pollution in the air, water or food, sedentary lifestyle, etc. PCOS is a genetic disease. It is caused by multiple genes. So PCOS is seen in families. If a mother is a PCOS patient, the likelihood of a daughter getting it is around 80 to 90%. How do female present with polycystic ovary syndrome? As we have already discussed, menstrual irregularities are the most common symptom, which can be irregular periods, excess bleeding, low bleeding, or no periods at all. Another presenting symptom is infertility, and sometimes they present with the problems of hyperandrogenism like acne, hirsutism, hair loss. Some ladies with PCOS present with hypertension, diabetes, etc. And sometimes it is an accidental diagnosis. When ladies present with hypertension, diabetes or hair loss, we do the ultrasound, and the ultrasound may show polycystic ovaries. And what are the effects of polycystic ovaries? As we discussed earlier, it can produce problems in the female life from the puberty through the reproductive age group and even after the menopause. Because of the excess estrogen, it can cause endometrial hyperplasia and endometrial cancer in the menopausal stage. Polycystic ovary disease is a part of the metabolic syndrome, and these ladies are more prone to lifestyle diseases like hypertension, diabetes, cardiac disease, and stroke, etc. So taking care of the long term effects of the PCOS is very important. And how do you diagnose the PCOS? One is one of all these symptoms which we have discussed earlier. Second is blood test, which is like we will see the hormonal pattern, whether some hormones are more and the male hormones are more in the blood level. And ultrasound. Ultrasound is the gold standard, where you can see the ovaries are enlarged and they will be studded with multiple cysts which are peripherally placed. And now we will discuss what are the effect of PCOS on the pregnancy. Actually, infertility is itself a big problem for the PCOS patient. It causes around 30 to 40% of infertility in the female. So, those with PCOS require some amount of treatment to get pregnancy. Once they are pregnant, there are more chance of miscarriages and PIH, gestational diabetes, and also more chances of small babies and preterm labor in these ladies. So, they need extra care during their pregnancy. Now, we come to the treatment of PCOD. Treatment of the PCOD depends on the age group and also the symptoms. Suppose it is the adolescent age group, mainly they present with the menstrual irregularities and features of hyperandrogenism. So, their treatment is directed to treat the hyperandrogenism and also the menstrual irregularities. If the patient is in the reproductive age group and if they present with infertility, the treatment is directed to treating the anovulation. Suppose the patient is presenting with abnormal uterine bleeding, the treatment is directed to deal with that. In the menopausal age group, when they present with endometrial hyperplasia and endometrial cancer, the treatment is directed to tackle that problem. So, as you know, whether it is a dangerous disease, polycystic ovary disease, it is actually, if you are taking good care with treating the symptoms properly and taking good care with your lifestyle changes like weight reduction and a healthy diet, you can bring this condition under control. Coming to the diet, these ladies are having an abnormal carbohydrate metabolism. So, they are advised to take a diet which is calories are less and less in refined sugars. So, they have to take more whole grain meals and also include more vegetables and fruits in their diet. It is better to avoid the fast food and the processed food, which will increase the intensity of the polycystic ovary. The mainstay of the treatment is diet and exercise. These ladies are advised to take exercise and diet control, their main mode of treatment. So, exercise they have to do 30 to 45 minutes of aerobic exercise, either in the form of walking, running or any cardiac exercise, at least 5 days in a week. So, today in a nutshell, I have discussed about the various problems of PCOD, and I hope this video is useful to you. Thank you.